High energy difficulties entail sustaining attention for extended durations or focusing on transition between thoughts or activities. Mainly hyperactive on tasks can be challenging. Individuals might struggle with remaining still or not, requiring well-established stimulation. Different modes of functioning can make it arduous for individuals to fit into structured, routine-oriented educational and many individuals show attributes from both of the above categories. It's worth exploring adaptation displays on an individual level among within their environment. Some believe that gender might influence how ADHD manifests. Regardless of their processing boys style, are up to 6 times more likely to be evaluated for diverse functioning compared to girls. Acknowledging strengths alongside challenges could arise, and celebrating the richness can be more challenging, often aligning with the hyperactive impulsive category. If assessment referrals occur during a person's early years, to fit into family physicians or teachers, which can make them appear less disruptive to educators and caregivers. Sometimes leading to the oversight or misinterpretation of their educational psychologists. Initial signs of ADHD generally manifest during childhood and are frequently identified during primary evaluations. While the difficulties associated with ADHD might alleviate over time, is typically into adulthood for a substantial portion of individuals. ADHD lacks a singular test, 50 to 70% brain scan. Essentially, many individuals with an ADHD diagnosis will experience some symptoms throughout their lives. Typically involves a range of steps awareness and evaluations, examining various aspects of an individual's life, potentially resulting in delayed diagnoses for individuals who have struggled without receiving appropriate to comprehend a child's development. A note on diagnosis and family dynamics. After reading the aforementioned description, with a child/young person or adult skepticism about diagnosing and medicating their children based on nonconformity with adult observations of the child's conduct and diverse skepticism regarding like ADHD and home as a condition is not uncommon. Questionnaires and psychological research and clinical communities have debated ADHD's including educational evaluation. Some assert that it's merely a clinical examination to rule out underlying medical or neurological causes for the individual's problems. This list isn't exhaustive, and assessment approaches might vary based on local services and the severity of each case. It's also crucial to recognize that certain conditions might resemble ADHD in certain aspects, example Asperger's or autism, leading to potential multiple diagnoses or initial misdiagnosis. Understanding life with ADHD. Edward M. Hallowell, an American psychiatrist diagnosed with ADHD, describes it as having a race car brain with bicycle brakes. He conveys that comprehending the experience of having ADHD can be difficult for others. To him, it's akin to a mixture of often contradictory tendencies and traits that swirl within you, influencing different aspects of your life at various times as it inconsistently navigates. 2006, p. 20. Hallowell captures the inconsistencies and contradictions in ADHD symptoms not always fully acknowledged elsewhere. He enumerates some perplexing ADHD characteristics. Other indications of ADHD encompass challenges in planning and organizing, unpredictability and impulsiveness, relatively lower inhibition, verbalizing and acting on immediate thoughts, ability to think swiftly, originally, and creatively, thinking outside the box, irritability and boredom in the absence of sufficient stimulation, a tendency to repeat mistakes multiple times. These tendencies can be daunting and impede educational and vocational attainment without appropriate support or comprehension. Moreover, consistent challenges in environments requiring organization, sedentary behavior, routine tasks, or prolonged concentration, such as school or work, can adversely affect mental and physical health, sometimes more than the initial difficulties. As previously mentioned, ADHD typically manifests in childhood and can manifest in diverse ways, including, but not limited to, the following. Psychology. Infancy/toddler years. Irritability, heightened crying compared to peers. Sleep issues. Selective eating habits. Restlessness. Preschool/nursery years. Short attention span, difficulties with sustained focus. Mood fluctuations, bursts of anger. Fine motor skill challenges. Limited interaction with peers. Primary school. Challenges in adhering to rules and sitting quietly. Reading problems, academic struggles. Difficulty collaborating with peers. Concentration and focus issues. Secondary school. Ongoing academic difficulties. Tendency to question authority. Time management problems. Forgetfulness. Tendency for boredom and distraction. Impulsivity and occasional irritability. Engagement in risky behaviors, smoking, drinking, substance use, sexual experiences, etc. It's conceivable that lacking proper understanding or support, a child or young person grappling with daily tasks and relationships might develop emotional and behavioral issues in response to their environment's reception. Children and youth might frequently face reprimands from parents and teachers, experience bullying, feel perpetually misunderstood or inadequate, and confront isolation and stigmatization. Particularly with young individuals, the impact of labeling and diagnosis communication warrants consideration. Adapted from the University of Derby online short course Understanding Autism, Asperger's and ADHD. ADHD in adults. As we transition into adulthood, our surroundings evolve, and we may pursue higher education or vocational training. Many of us will undertake numerous jobs, and some might even embark on multiple career paths. Financial independence is gained, offering new avenues for exploration and experimentation. Establishing families, caring for children and pets, managing mortgages, and more become part of the tapestry of life. While some individuals diagnosed with ADHD observe a reduction in symptoms over time or manage them effectively to near imperceptibility in adulthood, many continue to experience core ADHD symptoms throughout their adult lives. Absent the right strategies and support, this can lead to a host of challenges. Inattention and impulsivity can lead to workplace issues, unemployment, relationship difficulties, financial management struggles, and more. The sense of failure may linger, accompanied by feelings of loneliness, misunderstanding, and profound frustration with oneself and the world at large. ADHD often coexists with substance abuse, potentially driven by a proclivity for risk-taking behavior and attempts to self-medicate the emotional distress stemming from ADHD-related challenges. Additionally, the likelihood of depression and anxiety accompanies ADHD symptoms, contributing to low mood and heightened anxiety in affected individuals. The causes of ADHD. Despite extensive research and speculation, the precise causes of ADHD remain elusive. It appears that ADHD arises from a combination of contributing factors that interact in complex ways. However, it is firmly established that ADHD is not a result of poor parenting nor indicative of a bad character in the affected child or adult. While our understanding of the brain continues to evolve, certain neurological factors might be involved in ADHD's development. Imbalances in neurotransmitters, particularly in brain regions linked to self-monitoring and executive functions, have been observed. However, these imbalances are not unique to ADHD and can be present in various other conditions. Brain injuries during perinatal stages, from pre-birth to post-birth, can also impact the executive brain regions. Certain brain regions might be smaller in children with ADHD compared to their peers, although this discrepancy usually evens out as young people reach 16 to 18 years of age. Genetics play a significant role in ADHD, as it often runs in families. The existence of a genetic component is evident when multiple family members exhibit symptoms, indicating a high hereditary tendency. Other potential factors that have been discussed in the context of ADHD include lead exposure, allergies, food intolerances, deficiencies in vitamins or essential fatty acids, environmental free radicals, as well as stress or emotional issues. These factors should be seen as potential contributors rather than direct causes of ADHD in certain individuals. Support options for ADHD. While ADHD can be challenging, effective management can transform it into a source of strength, creativity, determination, and accomplishment. ADHD treatment often encompasses a multifaceted approach, incorporating lifestyle changes, dietary adjustments, medication, psychosocial training, and personal therapy. Tailoring the approach to individual needs and circumstances is crucial, and finding the right balance might require time and patience. Lifestyle changes and adjustments. Staying connected, human beings thrive on connections and acceptance. Surrounding oneself with people who understand and support you creates a sense of belonging, countering the challenges of ADHD-related relationship barriers. Embracing strengths, developing a sense of self that appreciates strengths and uniqueness can counterbalance symptoms affecting self-esteem. Focusing on strengths and talents helps bolster confidence. Discovering play. Engaging in activities that stimulate creativity and satisfaction can be therapeutic. This play is essential for all individuals but can be particularly beneficial for boosting self-esteem. Balancing structure and flexibility. Establishing routines aids focus and productivity. Incorporating variations and rewards can make routines more engaging, addressing ADHD's tendency for boredom. Mastering organization. Maintaining a centralized calendar for work, school, and social engagements ensures important dates are not overlooked. Utilizing colors or symbols for visual thinkers enhances organization. Managing screen time. Reducing screen time, particularly before sleep, enhances sleep quality. Disconnecting from constant updates and distractions can improve mental well-being. Prioritizing sleep. Establishing a bedtime routine aids relaxation and better sleep quality. Avoiding late-night eating and screen exposure improves sleep patterns. Engaging in exercise. Physical activity helps manage excess energy, alleviates depression and anxiety, and boosts coping mechanisms. Children and exercise. Encouraging children to exercise and explore hobbies can manage hyperactivity and foster social connections. Maintaining a balanced diet. Omega-3 fatty acids, found in fatty fish, are crucial for brain function. Eating a balanced diet supports mental and physical health. Medication. Medication usage for ADHD, particularly among children and young adults, has been widely discussed. The decision to use medication should be made case by case in consultation with a psychiatrist or GP. While medication is effective for many, 80 to 90% of cases, individual responses can vary. Medication considerations. Medication may lead to side effects such as headaches or irritability. It's important to address concerns or resistance, especially in children and young individuals. Collaboration with healthcare professionals is essential to monitor effects. Finding the right balance, adjusting medication and dosage requires careful consideration. Experimentation might be necessary to identify the most effective approach. Regular reviews with medical professionals are crucial. Stimulant medication. Stimulant medication, often prescribed for ADHD, doesn't overstimulate but helps regulate brain functions. It assists in controlling overfiring responses to external stimuli, improving focus and executive functions. It's important to remember that ADHD management is a multifaceted journey that might require adjustments over time. What works best for each individual can differ, and a comprehensive approach encompassing lifestyle changes, potential medication, and supportive strategies is often the most effective route to success. Whether or not to take medication in order to reduce and control common ADHD symptoms remains an individual decision. It is important to look into different options and to have a candid discussion with an experienced medical professional before putting yourself or your child on medication. It is also important to consider the alternative of not taking medication. What would the cost of that look like? What are the benefits and drawbacks? What are the main obstacles for you/your child in the context of medication? Behavioral and psychosocial support. If ADHD is diagnosed in childhood or adolescence, a variety of behavioral interventions can be useful in order to support the young person across different domains of life, such as school, home, and peer groups. There are numerous options, and what is right for the individual child/adolescent will depend on the circumstances and difficulties encountered. Training and support for adult caregivers. Supporting a child or young person with ADHD can be challenging, and parents and teachers can find themselves feeling somewhat helpless and frustrated. It is therefore important to develop a better understanding of what ADHD is about, how it can manifest, and how it can be supported and managed. Caregivers can familiarize themselves with the principles of behavior management, such as positive reinforcement, rewarding young person for desirable behavior, setting clear boundaries, and establishing a structure. Supporting a young person's social and interpersonal skills. If diagnosed with ADHD, the young person themselves is likely to experience some problems in communicating and interacting with peers and family members. Impulsivity, hyperactivity, angry outbursts, impatience, and other features of an ADHD mind can hinder the formation and maintenance of meaningful relationships, leading to a sense of failure and being constantly misunderstood or mistreated. Individual support from a child psychologist or counselor, as well as family sessions focusing on communication and behavior problem solving, can make a significant difference in a child's perception of themselves and others. Additional academic or vocational coaching and support. Depending on the person's particular situation and difficulties, specific coaching or training for problem areas can be valuable. This might include time management, organizational skills, study skills, exam preparation, writing skills, etc. Consultation with your GP, mental health, and educational professionals can help determine the most suitable support for you or your child. Personal therapy. Personal therapy for individuals with a diagnosis or symptoms of ADHD can be highly beneficial for various reasons. Therapy can assist in making sense of past experiences, processing feelings around the ADHD diagnosis, understanding present experiences, setting goals for change, discussing coping strategies, and more. Different types of therapy focus on various aspects, and exploring what type might be the best fit can be done through an exploratory session with a therapist. It is important to remember that the decision to pursue therapy or medication should be individualized and based on a thorough assessment and consultation with qualified healthcare professionals. ADHD is a complex condition, and its management requires a comprehensive approach that addresses both medical and behavioral aspects. The process of diagnosing ADHD involves utilizing specific diagnostic criteria from established systems such as DSM-4-TR, Diagnostic and Statistical Manual of Mental Disorders, 4th edition, text revision, and ICD-10, International Classification of Diseases, 10th revision. These criteria help healthcare professionals determine whether an individual meets the necessary conditions for an ADHD diagnosis. The DSM-4-TR criteria for diagnosing ADHD include: inattention symptoms, 6 or more symptoms of inattention, such as difficulty sustaining attention, frequent mistakes, forgetfulness, and difficulty organizing tasks, must persist for at least 6 months. Hyperactivity impulsivity symptoms, 6 or more symptoms of hyperactivity impulsivity, such as fidgeting, restlessness, talking excessively, and difficulty waiting for one's turn, must persist for at least 6 months. Combined type diagnosis: if an individual exhibits symptoms from both inattention and hyperactivity impulsivity categories, they receive a combined type diagnosis. Alternatively, if symptoms are primarily in one category, they might receive a predominantly inattentive ADHD or predominantly hyperactive ADHD diagnosis. Age of onset: symptoms should have been present before the age of 7 years. Pervasiveness: symptoms should be observed in at least 2 different settings, example, home and school. Impairment: symptoms should significantly impair social, academic, or occupational functioning. It's important to note that the criteria for diagnosing ADHD in adults may involve adjustments due to the developmental changes that occur with age. Furthermore, other conditions that might mimic or coexist with ADHD need to be considered and differentiated during the diagnostic process. The assessment of ADHD involves considering key clinical characteristics, such as the presence of core symptoms, their inappropriateness compared to developmental levels, duration of symptoms, impact on different settings, and potential coexistence with other disorders. There is no single definitive test for ADHD. Diagnosis relies on a comprehensive evaluation that includes input from various professionals and agencies using different assessment methods. It's worth mentioning that the process of diagnosing ADHD can be complex and is subject to some controversies and criticisms. These encompass technical challenges in accurately differentiating ADHD from other conditions, sociological aspects related to factors like gender, class, and cultural disparities, as well as debates about the validity of the disorder itself. Diagnosing ADHD requires a thorough and multidimensional assessment to ensure accurate identification and appropriate management. It's essential to involve qualified healthcare professionals who are experienced in evaluating ADHD symptoms and related factors. Key approaches. Clinical interview. A clinical interview is a fundamental part of the assessment process. It's typically conducted by professionals such as pediatricians, psychiatrists, clinical psychologists, or specialist nurses. The interview is often semi-structured to ensure that relevant issues are systematically explored. While fully structured interview instruments are used in research, they're less common in clinical practice due to their length and inflexibility. The primary goal of the clinical interview is to gather a comprehensive history of the individual's problems, along with information about their family, health, social context, education, and demographics. It's also important to understand how the individual and their family have coped with the problems over time and the impact of these problems on the family dynamics. The interview helps identify any additional assessments needed for accurate diagnosis and intervention planning. Standardized rating scales. Rating scales are valuable tools for assessing mental health, social, and behavioral problems. They come in 3 main types. Broadband instruments. These assess general behavioral and psychosocial functioning. The Strengths and Difficulties Questionnaire, Goodman, 2001, and the Achenbach Scales, Achenbach, 2003, Achenbach and Rescorla, 2001, are examples. Narrowband scales. These are specific to ADHD symptomatology. Examples include the Conners scales, Brown Attention Deficit Disorder Scale, ADHD Rating Scale, and others. Other rating scales, used to evaluate mental health symptoms associated with ADHD, such as anxiety, self-esteem, depression, and conduct problems. However, rating scales have limitations, including inter-rater reliability issues and incomplete sensitivity and specificity compared to full diagnostic assessments. They often describe symptoms without considering their developmental appropriateness or level of impairment. Educational and occupational adjustment. Understanding an individual's adjustment at school or work is crucial. Teachers may provide information on social and academic functioning, and direct observation of behavior in different settings, including classrooms, might be conducted. Medical assessment. Specialist clinical assessments by psychiatrists or pediatricians help rule out other disorders with symptoms that can mimic or coexist with ADHD. Prenatal and perinatal factors that increase ADHD risk are considered, and physical signs of certain genetic conditions associated with ADHD are identified. Medical examinations are crucial for confirming diagnosis and initiating drug therapy if necessary. Psychological and psychometric assessment. Educational and clinical psychologists might conduct further assessments if learning difficulties like dyslexia or cognitive impairments involving memory and attention are suspected. These assessments are essential to guide management and intervention plans. Epidemiology. ADHD is a common disorder. Prevalence rates vary across studies and populations. In the UK, prevalence rates of ADHD in children aged 5 to 15 years were estimated at 3.62% for boys and 0.85% for girls. Prevalence estimates differ due to measurement methods and definitions used. ADHD symptoms exist on a continuous spectrum in the population, and diagnostic criteria help differentiate affected individuals from unaffected ones. The presence of sufficient ADHD symptoms alongside clinical and social impairments is crucial for diagnosis. Adult ADHD. Prevalence in adults. The prevalence of ADHD decreases with age, as shown in longitudinal follow-up studies. By age 25, only around 15% of individuals who were diagnosed with ADHD as children retain the full diagnosis. However, a larger proportion, 65%, still exhibit some symptoms associated with clinical impairments, either as ADHD or in partial remission. Applying these findings to the prevalence range observed in children, 4 to 8%, one would expect around 0.6 to 1.2% of adults to retain the full diagnosis and a larger percentage, 2 to 4%, to have ADHD in partial remission. This aligns with population surveys estimating ADHD prevalence in adults at 3 to 4%. These findings suggest that applying the same clinical criteria used for diagnosing children to adults might lead to the underidentification of adult ADHD. ADHD symptoms decline developmentally, mirroring the natural decrease in inattentive, hyperactive, and impulsive behaviors seen in the general population. Prevalence estimates can vary unless age-adjusted criteria are consistently applied across studies. Etiology. Genetic influences. ADHD symptoms are strongly influenced by genetics. Twin studies suggest that approximately 75% of the variation in ADHD symptoms in the population is due to genetic factors, with a heritability estimate of 0.7 to 0.8. genetic influences affect ADHD symptoms across the entire population, not just a clinically defined subgroup. No single large effect gene has been identified for ADHD. Instead, multiple DNA variants of small effect have been associated with increased ADHD susceptibility. These findings have sparked debate over whether ADHD should be considered within the spectrum of normal variation or as a distinct medical disorder. However, genetic testing for susceptibility genes is not currently justified in clinical practice due to their limited predictive value. Environmental influences. Biological factors. Various factors during perinatal life and early childhood that negatively impact brain development are associated with an increased risk of ADHD or attention deficit disorder without hyperactivity. These factors include maternal smoking, alcohol consumption, heroin use during pregnancy, very low birth weight, fetal hypoxia, brain injury, exposure to toxins like lead, and zinc deficiency. These risk factors often interact with each other. For instance, the risk of ADHD linked to maternal alcohol consumption during pregnancy might be stronger in children with a dopamine transporter susceptibility gene. Research is ongoing to confirm direct risks for ADHD associated with these factors. Dietary factors. The influence of dietary factors on ADHD has garnered significant public attention, with claims that food additives, sugar, colorings, and numbers cause ADHD. Elimination and supplementation diets are often used without professional guidance. Epidemiological research suggests a link between additives and hyperactivity levels, and some children with ADHD might react idiosyncratically to certain foods or additives, benefiting from exclusion diets. Psychosocial factors. Severe early psychosocial adversity, such as institutional care deprivation, has been linked to ADHD. It's unclear why this association exists, but it could involve a failure to develop cognitive and emotional control. Families of individuals with ADHD often experience disrupted and discordant relationships. Such relationships might be both a consequence of living with ADHD and a risk factor for its development. Harsh parenting styles, discordant relationships, and family dynamics can contribute to the development of oppositional and conduct problems. Successful treatment of ADHD symptoms with stimulants can reduce parental hostility and criticism. Parents themselves might also have undiagnosed and untreated ADHD, affecting their ability to manage a child with the disorder. Current care and treatment of ADHD for children in the NHS. Recognition and treatment strategies. The provision of treatments and interventions for children, young people, and their families with ADHD varies. The ability to recognize and diagnose the disorder, as well as the organization of services for this group, is inconsistent as services transition toward comprehensive child and adolescent mental health services, CAMHS. Identification of affected individuals is often unsystematic and influenced by parental awareness or recognition of hyperactive behavior in their children. Services have historically been provided by CAMHS, specialists in learning disability psychiatry, or pediatricians based in child development centers or community child health departments. Stigma associated with mental health services can deter children, young people, and their families from seeking help. Referral pathways can be complex, with significant variability in local mental health service organization. Healthcare professionals in schools, primary care, secondary care, and other fields may have difficulty recognizing ADHD symptoms. Psychological therapies, parent training, and support. Psychological therapies for ADHD encompass psychoeducation, behavioral therapy, cognitive behavioral therapy, CBT, interpersonal psychotherapy, IPT, family therapy, school-based interventions, social skills training, and parent management training. School advice and support for residential institutions are also provided. Occupational therapy and speech and language therapy might assist in the development of individual children. Families of children with ADHD may require social support, including childcare relief, home assistance, and family support workers. Dietary measures. Health services generally do not commonly offer dietary supplements or restrictions as interventions for ADHD. However, many families use them with advice from voluntary or private sectors. Pediatric dietitians may be involved, especially when considering potentially hazardous interventions like exclusion diets. Medication. In the UK, atomoxetine, dexamphetamine, and methylphenidate are licensed for managing ADHD in children and young people. The NICE technology appraisal has determined that these medications are effective in controlling ADHD symptoms compared to no treatment. Methylphenidate, a central nervous system stimulant that inhibits the dopamine transporter, increasing dopamine availability for synaptic transmission. It's a Schedule II controlled drug licensed for children over 6 years old. Immediate release, IR, and modified release, MR, formulations are available. Common adverse effects include insomnia, nervousness, decreased appetite, abdominal pain, cardiovascular effects, and potential effects on growth. Dexamphetamine, a sympathomimetic with stimulant and anorectic activity, licensed as an adjunct for refractory hyperkinetic states in children from 3 years old. Similar adverse effects to methylphenidate, with a greater potential for diversion and misuse. Atomoxetine, a selective noradrenaline reuptake inhibitor licensed for ADHD treatment in children 6 years and older. Adverse effects include abdominal pain, decreased appetite, nausea, irritability, and mood swings. Some cardiovascular effects in cases of hepatic disorders have been reported. There have also been reports of suicidal ideation in a small number of affected children. Other medications, like atypical antipsychotics, bupropion, nicotine, clonidine, modafinil, tricyclic, and other antidepressants, might be prescribed off-label to non-responsive patients. Medications should only be initiated by qualified healthcare professionals with ADHD expertise following comprehensive assessments. Continued prescribing and monitoring might be carried out by GPs under shared care arrangements. Multi-agency working. Multi-agency working in relation to ADHD presents challenges. Collaboration between pediatricians and psychiatrists can lead to issues, often lacking clear arrangements regarding case distribution. Disagreements about diagnosis and service parity might arise due to informal arrangements. Collaborative working might be hindered by different disability models held by different agencies. Successful multi-professional teams for ADHD with protocols for working are emerging, including GPs' roles in monitoring care. However, difficulties persist during transitions between CAMHS and Adult Mental Health Services, AMHS, and a lack of support for adults with ADHD. Health services for children and young people with ADHD. Children and young people with possible ADHD should have access to local services for assessment and support. National services vary widely in terms of professionals available, service models, age of transition into adult provision, waiting times, and meeting the needs of children with learning disabilities. Referrals are made to primary mental health workers, nurses, child psychiatrists, psychologists, and pediatricians, leading to inconsistency in assessment and treatment protocols. Transition to adult services. Transition age into AMHS varies between 16 and 19, with efforts toward age 18 as recommended. Transition challenges stem from differing referral thresholds and service models. Gaps in provision after leaving children's services exist, with GPs monitoring and prescribing ADHD medication without specialist support. ADHD from an educational perspective. Children with ADHD tend to achieve lower grades than peers. Recent studies found lower reading and math attainment in children with teacher-identified ADHD characteristics. Inattentive symptoms have been linked to poor academic achievement. Teacher-identified inattentive, hyperactive, and impulsive behaviors have been observed in 8.1% to 17% of students, potentially leading to underdiagnosis. Starting school at 4 or 5 years old allows teachers to identify ADHD characteristics. The school environment's challenges might exacerbate these behaviors, but early interventions can be successful. Coordinated school-wide identification and interventions can improve outcomes. Despite positive impacts of classroom interventions on ADHD behavior, teachers in England are not systematically trained in these strategies. All children, including those with ADHD, deserve a broad, balanced, and relevant curriculum with appropriate differentiation. This calls for teacher training and whole-school approaches to positive behavior promotion. Teachers' competence in managing ADHD is variable and linked to their professional knowledge and experience. Current training lacks adequacy. The Education and Skills Select Committee recommended increased investment in training the workforce to improve outcomes for children with special educational needs and disabilities. Adults with ADHD. Treatment strategies for adults. Treatment strategies for adults with ADHD are similar to those for children, with some key differences. Identification of adult ADHD is uncommon in the UK, and specialist services are limited. Psychological treatment isn't routinely offered, and few attempts have been made to quantify its benefits. Specialist clinics for adults with ADHD are emerging, covering both transitional cases diagnosed in childhood and those diagnosed in adulthood. Many adults with ADHD are diagnosed and treated for coexisting symptoms and syndromes. Medication. Stimulants are the most studied and effective treatment for adult ADHD, similar to children. Methylphenidate and dexamphetamine are used, although they remain unlicensed for adults in the UK. The UK has seen a dramatic change in ADHD treatment for children, but this perspective change is slower for adults. Medication effects differ from psychiatric treatments, providing immediate effects. Atomoxetine is the second-line medication, followed by bupropion, modafinil, and antidepressants with noradrenergic effects. Atomoxetine is licensed for ADHD treatment in both children and adults in the US, but only for those who started in childhood or adolescence in the UK. Psychological treatments. Psychological treatments for adults with ADHD include psychoeducation, support groups, skills training, CBT, coaching, and counseling. Cognitive strategies have been used, often as a complementary treatment to medication. Psychological support starts at diagnosis, aiding adjustment, and then shifts focus to treating coexisting psychiatric and psychological issues and skills deficits. Special issues for adults diagnosed with ADHD. Educational and occupational disadvantage. Adults with ADHD often report erratic academic performance and underachievement. They're less likely to make plans, which affects future decisions. Academic problems are strongly linked to ADHD symptoms. Tutoring, extra exam time, and help with time management can alleviate these issues. Substance misuse. ADHD is a risk factor for substance use disorders. It's associated with increased reward-seeking behavior, psychosocial impairments, and self-medication. Severe substance use disorders should be treated first. Ongoing substance misuse interferes with evaluating ADHD treatment response. Association with crime. ADHD is associated with early-onset criminal behavior. Studies suggest a higher prevalence of ADHD in young offender institutions and adult prisons. ADHD is an independent predictor of antisocial behavior. The link between ADHD and crime is increasingly recognized and concerning. Differential diagnosis and mistaken diagnosis. Coexisting conditions in adults include personality disorders, bipolar disorder, and obsessive-compulsive disorder. Attention problems are common across psychiatric disorders. ADHD in adults is frequently misdiagnosed due to symptom overlaps with other conditions, leading to contact with mental health services for ADHD patients. Psychopathology overlaps. ADHD symptoms in adulthood can be mistaken for traits of personality disorders. The volatile and irritable mood in ADHD overlaps with bipolar disorder. Clarifying the diagnosis is crucial to avoid falsely identified cases. The economic cost of ADHD. Prevalence and costs in the UK. The estimated prevalence of ADHD in children and young people in the UK is 3.62% in boys and 0.85% in girls. Based on these figures, around 210,000 children aged 5 to 18 years in England and Wales are affected by ADHD. The cost of ADHD on health, social, and education services in England and Wales is substantial, with initial specialist assessments costing £23 million and annual follow-up care costing £14 million, excluding medication costs. These figures don't include costs incurred by adults with ADHD for health and social services. Prescription costs and estimates. In 2006, the annual cost of prescribed stimulants and other drugs for ADHD in England was approximately £29 million, with a 20% increase from the previous year. Estimated expenditures for ADHD pharmacotherapy in children and young people in England could exceed £78 million by 2012. However, the current annual cost of prescribed drugs for ADHD in England is still lower than drugs prescribed for other chronic conditions like depression and diabetes. U.S. data and economic costs. U.S. data on the economic cost of ADHD are different due to a different pattern of service provision. In the U.S., the total cost of ADHD in 2000 was estimated to be $31.6 billion, with only 5% directly related to treatment. The rest comprised healthcare costs of children and adults with ADHD, healthcare costs of family members of those with ADHD, and productivity losses. The estimated annual cost of ADHD in children and young people in the U.S. was around $14,600 per individual, with healthcare, education, crime, and delinquency costs. Healthcare costs and impacts. Children with ADHD have healthcare costs similar to those with asthma and higher than those without ADHD. They have more frequent contacts with general practitioners, outpatient mental health services, emergency departments, and hospitalizations. Coexisting psychiatric conditions increase healthcare use and costs. Children with ADHD are also more likely to have learning difficulties and higher educational costs. Adults with ADHD also incur higher healthcare costs despite low treatment rates. They're more likely to have comorbid conditions, contributing to higher medical expenses. Families of individuals with ADHD also bear significant out-of-pocket expenses and productivity losses. Overall impact: ADHD incurs significant financial and emotional costs to healthcare systems, education services, families, and society. Effective treatment can improve the quality of life for individuals with ADHD and their families, while reducing the financial and psychological burden on society. ADHD in children and adults. Most of us will have heard of the term ADHD, but research has found that there are many misconceptions and myths surrounding this common condition. The following broadcast is intended to provide an overview of what ADHD is, how it can be assessed, how it may develop, and what can be done to support those of us with ADHD. It also offers some additional resources for further reading and information. What is ADHD? ADHD stands for Attention Deficit and Hyperactivity Disorder and is generally regarded as one of the most common, yet also most controversial childhood developmental conditions in the world. In the UK, it is thought that between 3 and 9% of school-aged children may have ADHD, though figures remain subject to debate. ADHD is understood to be a cluster of symptoms that can include hyperactivity and impulsivity, as well as problems with attention and focus. In fact, healthcare professionals today distinguish between 3 main subcategories of ADHD. Predominantly inattentive presentation, the main problem is that individuals struggle to pay attention for longer periods of time or stay focused on a particular task. Predominantly hyperactive impulsive presentation, individuals may struggle with sitting still. They may need constant stimulation and entertainment and tend to be more active than the average person. Combined presentation, many individuals will show features of both of the above categories. ADHD looks different in different people. Some believe that there is also a difference between how ADHD manifests in boys and girls. Boys are up to 6 times more likely to be assessed for ADHD than girls. It is possible that boys' symptoms are more likely to be noticed by the adults around them because their behaviors can be more challenging, often fitting with the hyperactive impulsive category. Girls, on the other hand, are thought to be more likely to fit into the inattentive category, making them less disruptive in the eyes of teachers and caregivers and sometimes leading to their problems being overlooked or misinterpreted. The first signs of ADHD will usually develop in childhood and are often picked up during the primary school years. While the problems and struggles associated with ADHD can diminish over time, in many cases they last into adulthood. Research suggests this is the case for about 50 to 70% of people with ADHD. In other words, many people who have an ADHD diagnosis will experience some of the symptoms for life. Awareness around ADHD and other developmental conditions is more common today than it was in the past, sometimes leading to late diagnoses for individuals who have struggled all their lives but never received any support. A word on diagnosis. You may have read the above description and silently rolled your eyes, murmuring something about how we have come to diagnose and medicate children for not conforming to adult norms of behavior. You wouldn't be alone in your skepticism about ADHD as a condition. The research and clinical communities have debated the existence of ADHD for many years, with some being convinced that the condition is a mere cultural construct of adults' inability to tolerate and understand normal childhood behavior, and others advocating for ADHD's recognition as a disabling psychiatric condition. Whichever point of view you are leaning to, there is plentiful evidence that human beings function differently. Healthcare and educational professionals sometimes refer to this as neurodiversity. What this means in practice is that we all differ from one another in terms of our general energy levels, our ability to focus, our creativity, our need for stimulation and thrills, our need for social interaction, and our ways of expressing ourselves. If you are someone who experiences high levels of energy, a need to be active and seek out novel thrills, a tendency to jump from one thought or activity to the next, you may struggle with tasks that require concentration and sustained attention. Whether we apply a label or not, it is a well-known fact that certain ways of functioning can make it harder for people to fit in with the structured, routine-based environments often provided by educational and employment contexts. If we accept that, it is worth exploring how things can be adjusted, both by the individual but also their environment, to ensure that everyone has a chance to contribute and partake in society, no matter their process. It may also mean that we have to take a step back from describing different ways of functioning as disorder, recognize the strengths as well as the challenges, and celebrate the diversity of human existence. Assessment for ADHD. If a referral for assessment is made during a person's younger years, it will often be the family GP or teachers who first identify the symptoms and suggest a referral. Often there are a number of people involved in making a clinical judgment: GP, child or educational psychologist, child psychiatrist, pediatrician or other healthcare professionals. If it is a parent or caregiver who initiates the assessment, the best first port of call will usually be the GP or a school psychologist. There is no single test for ADHD, no blood test, brain scan, or physiological examination that can show a person has the condition. In order to arrive at a diagnosis, clinicians will usually suggest a variety of steps and assessments, looking at different areas of a person's life. These can include interviews with parents/carers to get a sense of a child's development and behavior, as well as a picture of what is going on in the family as a whole. Interviews with the child/young person, or the adult client, if a diagnosis is made later in life, to get their perspective on what they are struggling with. Observations of the child's behavior in different settings, such as school, home environment, etc. Questionnaires and psychological assessments to look at different areas of functioning. This can include educational assessments, e.g. of reading skills, etc. Clinical examination to exclude any underlying medical or neurological issues that could explain the problems the individual is experiencing. This list is not exhaustive, and the structure and depth of the assessment can depend on local services and the severity of the problems presented in each individual case. It is also important to note that other conditions can look somewhat similar to ADHD in certain aspects, for example Asperger's or autism, and it is not uncommon for children and adults to receive multiple diagnoses or be misdiagnosed at first. What does it mean to have ADHD? Edward M. Hallowell, an American psychiatrist, who has a diagnosis of ADHD himself and has written some seminal books on the topic, describes having ADHD as having a race car brain with bicycle brakes. He notes that it can be hard to understand for others what it feels like to have ADHD. To him, it can be like having a melange of often contradictory tendencies and traits that swirl around within you, stirring up different parts of your life at different times as it makes its inconsistent rounds. 2006, p. 20. Hallowell captures the inconsistencies and sometimes outright contradictions in ADHD symptoms in a way which is not always fully acknowledged in other accounts or diagnostic manuals. He lists some of those at times perplexing features of ADHD. Other signs of ADHD can include trouble with planning and organizing. Unpredictability and impulsivity. Relative lack of inhibition, saying and doing what comes to mind. Ability to think fast, originally, and creatively / thinking outside of the box. Irritability and boredom when not stimulated enough. Tendency to repeat the same mistake several times. These tendencies or symptoms can be hard to deal with and get in the way of educational or occupational attainment if there is no appropriate support or understanding available. However, coming up against near constant challenges in environments that require being organized, sitting still, doing routine tasks or concentrating for long periods of time, such as school or work, can have serious consequences for a person's mental and physical health. Sometimes those consequences can be much harder to deal with than the original difficulties. As mentioned before, ADHD typically starts to manifest in childhood and can express itself in a number of ways, which can include, but are not limited to, the following. Psychology. Infancy / toddler years. Irritability, tendency to cry more than other children, problems with sleep. Being fussy with food. Restlessness. Preschool / nursery years. Short attention span, F.X. Struggling to listen to long stories, mood swings, angry outbursts. Fine motor skill problems. Not interacting as much with other children. Primary school. Problems to sit quietly and follow rules. Problems with reading, struggling academically, problems collaborating with other children. Problems with concentration and focus. Secondary school. Ongoing problems with academic tasks, tendency to challenge authority. Problems with time management. Forgetfulness. Being easily bored and distracted. Being impulsive and at times irritable. Engaging in risky behaviors, smoking, drinking, drugs, sexual experiences, etc. It is easy to imagine that a child or young person struggling with everyday tasks and relationships at home and at school in the absence of adequate understanding and/or support can start to develop emotional and behavioral problems in reaction to how they are met by their environment. Children and young people may experience frequent reprimands from parents and teachers, be bullied by other children, feel permanently misunderstood or stupid, and face loneliness and stigmatization. With young people in particular, it is important to consider the impact of a label and diagnosis and how this is communicated. Taken from the University of Derby online short course Understanding Autism, Asperger's and ADHD. ADHD in adults. As we move into adulthood, our environments change and diversify. We may go to university or engage in vocational training. Most of us will have a number of jobs and some will have more than one career. We also gain financial independence. New avenues of spending and experimenting open up. We may have a family of our own, children to look after, pets, mortgages, etc. Many will. For some of those diagnosed with ADHD, the symptoms decrease over time or may become so well managed that they are barely perceptible in adulthood. However, many others will experience the core ADHD symptoms throughout their adult life. Without the right strategies and support, this can lead to all kinds of problems. Symptoms. Inattention and/or impulsivity can lead to problems in the workplace, unemployment, difficulties in personal relationships, problems with managing finances, paying bills, etc. The feeling of failure can be a constant companion, as well as feeling lonely, misunderstood, and utterly frustrated with oneself and the world at large. It is not uncommon for ADHD to go hand in hand with some form of substance abuse, may be both due to a proneness towards risk-taking behavior and an attempt to self-medicate the emotional pain that is caused by the difficulties of having ADHD. Furthermore, the co-occurrence rate for depression and anxiety with ADHD is relatively high, which means that many people who display symptoms of ADHD also suffer with low mood and anxious feelings. What causes ADHD? Despite much research, and probably even more public speculation, it is still not clear what causes ADHD. In fact, it seems much more likely that ADHD is brought on by various contributing factors which can interact in complex ways. What is, however, well established is that ADHD is not caused by poor parenting, nor is it a sign of bad character of the child or adult who is presenting with the condition. Our knowledge and understanding of the brain are evolving all the time, and there are still many processes and areas of the brain that are not well understood. However, there is some evidence that there may be neurological factors implicated in the development of ADHD. For example, scientists have found that there can be an imbalance in neurotransmitters, the chemical messengers in the brain that are underlying our emotions, reactions, etc., specifically in the brain regions associated with self-monitoring, inhibition, and other executive functions. At the same time, such imbalances are not unique to ADHD and can play a part in many other conditions. The previously mentioned executive part of the brain, known as the prefrontal cortex, can also be damaged by perinatal injury, that is, injuries sustained before, during, or after birth. Such brain injuries can be caused by various events, such as infection, physical trauma, or the lack of oxygen at birth. Other research has also suggested that certain brain regions are smaller in children with ADHD compared to their peers. This difference in size disappears with time, and by the age of 16 to 18, young people's brains will usually have caught up in terms of development of those regions. However, there can still be some developmental delays that can affect a young person's life in school and at home. There has been good evidence that there is a large genetic component to ADHD. For example, it is often found that ADHD runs in families. If one child is diagnosed with ADHD, it is not unlikely that siblings, parents, even grandparents may also have shown symptoms. Sometimes one diagnosis leads to several more within the same family, pointing to the fact that ADHD is highly heritable. Other potential causal factors that have been discussed in the context of ADHD include the ingestion of lead, allergies and food intolerances, the lack of certain vitamins or essential fatty acids, the existence of free radicals in the environment, as well as stress or emotional problems. The evidence here is not conclusive, and it may be better to think of those factors as potential contributors, rather than causes for ADHD in some individuals. Support options for ADHD. While having ADHD can be debilitating in many areas of life, if effectively managed, it can also be the source of strength, creativity, drive, and achievement. The treatment for ADHD often consists of a variety of components, referred to as multimodular approach to treatment, including changes in lifestyle and diet, medication, psychosocial training, as well as personal therapy. There is no one-size-fits-all, and what is most useful depends on individual needs and circumstances. It is worth noting that it can sometimes take a while to find the right mix, and the journey can at times be frustrating. Below we will consider some of the pieces of the puzzle. Lifestyle changes and adjustments. What can you do yourself? There is good evidence that there are a few important changes that can help children, as well as adults, to better harness that race car brain. Stay connected. Human beings are social animals, and it has been proven that those of us who feel connected to others and themselves live longer and healthier lives. Surround yourself with people who understand and accept you for who you are, instead of criticizing you for who you are not. ADHD is still often not well understood by the public at large, which can get in the way of building relationships. You may at times have to explain how you function and process, educate others on what it means for you to have ADHD, or address some of the preconceived notions that others may have. Finding your crowd can provide a sense of safety and belonging, key to a happier life. Remember your strengths. Staying connected with trusted others is important, but so is being connected with yourself. Part of that is developing a sense of your strengths and uniqueness, things you excel at, your interests. Your personality. Unfortunately, some of the symptoms of ADHD, inattentiveness, forgetfulness, hyperactivity, etc., can lead to criticism from others and impact on a person's self-esteem over time. Therefore, it is important to connect to a more positive sense of self and remember the strengths and talents we all have. Find your play. Edward Hallowell, an American physician and prolific writer on ADHD, suggested that one of the keys to happiness is finding an activity that you truly enjoy, something that makes your brain light up, engages your creativity, and is deeply satisfying. He calls this type of engagement with something play. Play is useful for all of us, whether we have ADHD or not, but Hallowell suggests that play, practice, and getting better at something you can truly connect to can be particularly beneficial for those of us whose confidence and self-esteem may have been dented. Structure, with flexibility. Having a good routine and structure in life can really help, and not just for those of us with ADHD. It can be helpful to set yourself alarms and reminders and make sure you get enough sleep, eat well, and plan adequate breaks during your working or studying days. As many people with ADHD can get bored easily and lose interest in doing the same thing every day, it may be worth thinking about variations and fun elements within the routine. Be creative, change things around, reward yourself. The same is true for children with ADHD. Parents and caregivers may want to work with teachers and/or a therapist, as well as the child, to come up with strategies that allow for routine, as well as flexibility. Have a master plan. It can be really helpful to have one planner or calendar for all your work, school, or social engagements. Some may prefer paper-based planners. Others may use technological alternatives such as iCalendar or Google Calendar. Once you have found one that works for you, try and be consistent in your use and put all your appointments, deadlines, meetings, shifts, and other important dates into the same calendar as soon as possible. If you are a visual thinker, you may want to use colors or symbols, as long as you have all the pertinent information, date, time, location, etc. There, you can be as creative as you want to be with it. Being mindful of screen time. We live in a world of constant updates and infinite distractions. The latest news, the newest version of Candy Crush, the never-ending social media updates of friends, family, or celebrities are always only a few clicks away. It can be tempting to look at your phone late at night, take it to bed with you, glance at its screen during work, university, or school hours. It may be useful to switch off your devices, or at least notifications, for a few hours a day to give yourself a break. Let friends and family know that you are taking some time off and might not respond immediately to their messages. Reducing screen time before bed can also significantly improve sleep, leading to our next point. Have a healthy sleep routine. Now sometimes dubbed sleep hygiene, it can be really important to establish a bedtime ritual that allows you to relax and calm down from the day's activities and excitements before going to bed. This will vary. For different people, it might be listening to calming music, having a cup of tea, reading, meditating, etc. Avoid eating late at night or watching television/spending time on your phone or computer, as these activities can get in the way of your sleeping patterns. For example, looking at a bright screen can make our brain think it is day rather than night, stimulating us in ways that make it harder to fall asleep. Exercise. Exercise can be an excellent way to get rid of some of that excess energy, as well as being a natural antidepressant and a great coping strategy for anxiety. Find something you enjoy doing, get creative, and try new things. Children are often naturally energetic. If your child has a tendency to be hyperactive, it can be useful to encourage them to exercise, let off some of that steam, find new hobbies, and potentially make new friends. Eat well. We all know that eating a healthy, balanced diet is key to mental and physical well-being. When it comes to ADHD, researchers in recent years have begun to hone in on omega-3 fatty acids, for example found in fatty fish such as salmon and tuna, and their importance in brain functioning. A lack of omega-3 fatty acids in our diet can lead to low-level, yet detrimental, inflammation throughout the body. Furthermore, it has been shown that increasing omega-3 fatty acids in a person's diet can help with concentration and focus, as well as improving memory and sleep. It is important to talk to your GP or a qualified nutritionist about your individual needs and to establish whether you have a deficiency in omega-3s and how to best address it. Medication. Much has been written about the use of medication in the context of ADHD treatment, particularly when it comes to children and young people. Whether medication could be useful should be decided on a case-by-case basis together with you or your child's psychiatrist or GP. While medication really works for many, it is estimated that mediation can be helpful in 80 to 90% of cases. It has no or little effect on others. It should also be noted that medication on its own is seldom enough and that most people with ADHD, whether child or adult, would benefit from some additional support. Finding. Moreover, some people can experience side effects from medication, such as headaches, nausea, insomnia, loss of appetite, or irritability. In addition, the person can sometimes feel that they are losing the fun and sparkling part of their personality when on medication, which can be difficult to accept. Compliance with medication can also be a problem, particularly in children and young people, and even more so when the medication has undesirable side effects. It is important to take any concerns or resistance seriously and have an open and understanding discussion with your child/young person about the impact of medication on their life. If it is decided that medication is an option, finding the right medication and dosage can be a real balancing act, and sometimes it is necessary to try different combinations before finding the one that works. It is also important to review medication with a medical professional on a regular basis, at least annually, discussing side effects and any other problems that might come up for you or your child. For more detailed information, please see the link to the NICE guidelines at the end of this guide. The type of medication that is typically prescribed for children and adults with an ADHD diagnosis is stimulant medication. This may at first seem counterintuitive. Why stimulate a brain that already seems overstimulated? Indeed, it is often misunderstood what stimulant medication does. We are still learning about the effects of different medications on the brain, but it is thought that stimulant medication can help stimulate the brakes of the brain. Remember E.M. Hollowell's image of the ADHD brain as a race car with bicycle brakes. In other words, stimulant medication can help the brain slow down and inhibit the chemical/neural mechanisms and processes that cause the brain to constantly fire in response to external stimuli. This slowing down can help mental focus and improve what we call the executive functions of the brain, such as planning, decision-making, organizing, and prioritizing. Having more control and focus can in turn enhance performance at school or work, increase patience, and reduce the feelings of anger and irritability that come with feeling constantly overwhelmed. Often stimulant medication can make a difference to mood and general emotional well-being. Whether or not to take medication in order. The main difference between different types of stimulant medications is how long they last and, consequently, how frequently they have to be taken. The last few decades have seen the development of improved longer-lasting stimulant medication. The advantage of this type of stimulant is that it only has to be taken once a day instead of several times daily, and the benefits can last throughout the school or working day where concentration and focus may be particularly important. To reduce. Whether or not to take medication in order to reduce and control common ADHD symptoms remains an individual decision. It is important to look into different options and to have a candid discussion with an experienced medical professional before putting yourself or your child on medication. Common. It is also important to consider the alternative of not taking medication. What would the cost of that look like? What are the benefits and drawbacks? What are the main obstacles for you/your child in the context of medication? Behavioral and psychosocial support. Symptoms and control. ADHD. If ADHD is diagnosed in childhood or adolescence, a variety of behavioral interventions can be useful in order to support the young person across different domains of life, such as school, home, and peer groups. There are numerous options, and what is right for the individual child/adolescent will depend on the circumstances and difficulties encountered. Training and support for adult caregivers. Supporting a child or young person with ADHD can be challenging, and parents and teachers can find themselves feeling somewhat helpless and frustrated. It is therefore important to develop a better understanding of what ADHD is about, how it can manifest, and how it can be supported and managed. Caregivers can familiarize themselves with the principles of behavior management, such as positive reinforcement, rewarding young person for desirable behavior, setting clear boundaries, and establishing a structure. Supporting a young person's social and interpersonal skills. If diagnosed with ADHD, the young person themselves is likely to experience some problems in communicating and interacting with peers and family members. Impulsivity, hyperactivity, angry outbursts, and impatience and other features of an ADHD mind can get in the way of forming and maintaining meaningful relationships, which can lead to a sense of failure and being constantly misunderstood/mistreated. Getting some individual support from a child psychologist or counselor, as well as having some family sessions that focus on collective problem solving around communication and behaviors, can make a big difference to how a child feels and perceives themselves and others. Additional academic or vocational coaching and support. Depending on the person's particular situation and difficulties, it can be worth looking at specific coaching or training for problem areas. This may include